Experts say it is hard to know just how prevalent the COVID-19 variants are right here in North Carolina. Over the weekend, we told you about the first case of the UK strain detected in Mecklenburg County, Charlotte. Scientists are concerned about that variant spreading more easily among people. Our Capitol reporter, Michael Hyland, getting answers for us tonight live in Raleigh. And Michael, you spoke with the lab that actually discovered that case today.
Right. The CDC is updating this map here. When they do tonight, it'll include North Carolina as being among the states where the UK variant has been detected. Experts I talked to, though, say they need better data, especially as public health officials figure out how to navigate these next few months. Confirmation of the expected. Mako Medical, based in North Carolina, identified the first case of the UK strain of COVID-19 in a person in Mecklenburg County. Steve Hoover is VP of Lab Operations at Mako. Do you think at this point we have a very good idea of how widespread the variants are in the United States?
No, I don't. I think we're in the early stages of a lot of the sequencing. I think a lot of labs are kind of picking up on this as an important area to go into.
Hoover says his company processes about 20 to 25,000 positive COVID-19 tests each week. Of those, they're able to do genetic sequencing on only about 50 to 100 to see if they can detect any of the variants. Hoover says that can cost $100 to $150 a sample, making it hard to do this on a larger scale.
We're hoping there's some funding that's going to be going into the sequencing part, because I think there is a lot to learn.
He says getting better data to public health officials is key as they make decisions about reopening and vaccinations. Dr. Dirk Dittmer's lab at UNC is also looking for new variants.
To not impact your disease or how you're treated. It helps us predict the future.
Hoover says Mako has not seen any cases of the variants from Denmark or South Africa. Moderna said Monday it's working on a booster shot for its vaccine to better protect against the South African variant. The head of the CDC says they're scaling up surveillance of the variants and how they impact vaccines and treatments.
It's probably a little more prevalent than you're seeing right now. You just don't have the testing ability to ID all of those.
Hoover says ideally they'd like to do genetic sequencing on samples that they get where there's an indicator that they could be one of the variants right away. That way they can get that information quickly to local health departments and they can do the contact tracing that's necessary to try to limit the spread of the virus. Live in Raleigh, Michael Hyland, CBS 17 News.